Okay guys, in this video we're going to go over the electrical system of the heart. Hopefully this video will help you better understand how the heart conducts electrical impulses and creates the PQRST that you see on an EKG. So first let's review the location of the electrical system and the components that are involved. So here you have the heart. It has 4 chambers. It has 2 atriums, a right atrium and a left atrium. And he has 2 ventricles, the right ventricle and the left ventricle. So low oxygen blood will come from the body into the heart and go through the right atria to the right ventricle and into the lungs, gets oxygenated and goes into the left atrium, down to the left ventricle, and then gets pumped out to the body. For this to happen, the atria and ventricles need to contract to squeeze out all the blood to its destination. So what causes them to contract is when a negative charged cell becomes more positive, which is known as depolarization. So if you think about it this way, if you get struck by lightning, your whole body will contract and all the muscles in your body will squeeze and you won't be able to move, which is pretty much the same thing that's happening in the heart. The heart is getting struck by lightning, causing the muscles to contract and squeeze out all the blood. For this to happen, you need an electrical charge. So let's take a look at the electrical system of the heart and the elements involved. First, here you have the SA node, which is a sinoatrial node, which is located right here. It is also known as the natural pacemaker of the heart. The cells in the sinoatrial node are unique because they can depolarize by themselves, which is known as automaticity. The SA node is the main component that sets a basic rhythm of the heart. It has a rate of 60 to 100 beats per minute, which equals to a normal heart rate. And here you have the AV node, which is the atrioventricular node, which is the backup pacemaker, and has a rate of 40 to 60 beats per minute. And then you have this area called bundle of His, which then splits into the right and left bundle branches. And in the end down here, you have these fibers known as Purkinje fibers. In the normal heart, an electrical signal originates at the sinoatrial node. It then propagates through both atrias, which allows the atria to depolarize, causing the atria to contract. It then spreads to the atrioventricular node and passes through the bundle of His to the right and left bundle branches, and then to the Purkinje fibers, causing the ventricles to depolarize and contract. This electrical activity is recorded as a PQRST on an EKG. So here you have a normal sinus rhythm on an EKG. You have a P wave, which is a recording when the SA node is firing an electrical signal, causing the atria to depolarize. The QRS is a recording of the AV node firing electrical signals down to the ventricles, causing them to depolarize. And then here you have the T wave, which is ventricular repolarization, which repolarization is when a positive charged cell is becoming more negative, allowing the muscles to relax. Hopefully this video helped you better understand how an electrical charge travels throughout the heart and what each section of the PQRST stands for. Because understanding what happens during each section on an EKG, you'll be able to faster read what type of arrhythmia the patient is experiencing. For example, if you're able to see the QRS, but you can't see the P wave, or if the P wave looks abnormal, then you know that the arrhythmia is most likely going to be atrial related. For example, atrial fibrillation or atrial flutter.